Alright, I'm Tyler Alonso. I'm in Dr. Cure's class. I'm doing the video on the cranial nerves. So basically, there's the olfactory, the optic, the oculomotor, the trochlear, trigeminal, abducens, facial, vestibulocochlear, glasopharyngeal, vagus, accessory, and hypoglossal nerves. So, all right, so for the first cranial nerve, it's going to be the olfactory nerve, purely sensory. It innervates the olfactory mucosa and the superior nasal cavity and provides the sense of smell. And then the second nerve will be the optic nerve. This is also purely sensory. It gives the sense of vision, and also it emerges from the retina of the eye to meet the optic chiasma, and it also partially exchanges axions before diverging into the optic tracts. And then the third will be the ocular motor nerve, which is a motor nerve which will move the eyeball and the muscle that opens the eyelid. And then the fourth will be the trochlear nerve, which will move the superior oblique muscle in the eye. And then the fifth nerve will be the trigeminal nerve. The trigeminal nerve is a mixed nerve that provides sensory information for the face and also moves the muscles for chewing. And then the sixth, it will be the abducens nerve, which basically moves the final part of the, so there were 6 muscles in the eye. This will be the last one, which will be the lateral rectus muscle. And then the seventh nerve will be the facial nerve. So for the facial nerve, it'll obviously it'll provide motor capability to the muscles in your face. And it'll also be the taste for the anterior 2/3 of your tongue. It can also produce tears and the mucus and saliva for your mouth. And then the eighth will be the vestibular nerve, which is a sensory nerve. This will move the structures in the ear and provides the senses for hearing, and also the equilibrium within your head. And then the ninth will be the glossopharyngeal nerve, which is a mixed nerve. This will provide movement for the muscles in the pharynx for the throat, and will be involved for swallowing. And also the sensory fibers from the posterior 1/3 of the tongue, and for taste, sensation. And then vagus, the wandering nerve, will be a sensory nerve. This will give us sensation for the skin of the head and for the pharynx, and then the motor muscles for speech and swallowing, and also some for salivary glands. And then the 11th will be the accessory nerve, which will move the muscles in the head and the neck, so like your sternocleidomastoid and your trapezius muscles. And then the last will be your 12th, hypoglossal nerve, which moves the muscles in your tongue. It moves the muscles moves your tongue, but does not provide any taste sensation for the tongue.